Now we will discuss the muscle of the medial compartment of thigh. The medial compartment of thigh contains all the adductors of thigh. There are 5 muscles, 3 adductors: adductor longus, brevis, magnus, Gracilis, and Obturator externus. Okay. Now we will first come through this adductor longus. This one is the long muscle. Here is the adductor brevis, a short muscle. Here is one anterior and a posterior view of adductor magnus. This one is an obturator externus, and here is an gracilis, a very thin muscle here, almost most medially. Okay, now come towards their origins. This is the front of the hip bone of left side. Okay, left hip bone. This region is the body of the pubis. This one is the superior ramus of pubis. This one is the inferior ramus of pubis. This is the origin of adductor brevis, the small origin in a body of pubis. This labeled one is the origin of adductor longus, and this whole is the origin of adductor brevis. Adductor magnus. Adductor magnus has 2 parts. The adductor part takes origin from this ramus of ischium. Okay, and the hamstring part of the adductor magnus takes origin from this ischial tuberosity. You can see from here also, this whole is the here is the adductor magnus. This one is the hamstring part on ischial tuberosity, and this one here and this one here on the ramus of ischium is the adductor part. Okay, the 4th muscle is Gracilis, this labeled by 6. Okay, and the 5th muscle is Obturator externus. From here the obturator membrane of the obturator foramen, and this the margin of obturator foramen. Okay, these are their origins. Now comes towards the insertion of the 3 adductors are in relation with each other. This whole, this is the gluteal tuberosity. Okay, from here is the linea aspera. This is the lateral lip of linea aspera, and this one is the medial lip of linea aspera, and this one is the pectineal line. Okay, so now starting from above to downward, from this pectineal line and the upper part of linea aspera, here in this region there is the insertion of adductor brevis. First comes B, adductor brevis. Okay, from this pectineal line and this the upper part of linea aspera. Okay, from the middle part of the linea aspera there inserts the adductor longus. Both of these are medially. It's a left femur, it's a medial side of left femur, it's lateral side of left femur. Here adductor brevis, first B, and then adductor longus, then L, BL. Okay, and from this whole gluteal tuberosity and this linea aspera and this medial supracondylar line, this whole is the insertion of adductor magnus. It's the insertion of adductor magnus. Gluteal tuberosity यहाँ तक, then linea aspera यहाँ तक, and then this medial supracondylar line. Okay, this whole is the insertion of the adductor part of adductor magnus. Okay, and the insertion of the hamstring part of adductor magnus, it is here on the adductor tubercle. Adductor tubercle is on the medial epicondyle. Okay, here is the adductor tubercle, and this is the insertion of the adductor part of adductor magnus. Okay, Now for the insertion of obturator externus, it get inserted into the trochanteric fossa of the greater trochanter of femur. Okay, as it is get inserted here, so wing posteriorly when it acts, it laterally rotates the thigh. Okay, it's a lateral rotator, and the second one, it holds the head in the acetabulum, the main two functions of this obturator externus. Okay, and the last one, Gracilis, it's get inserted on the medial surface of tibia. This is tibia, this is medial side. From see here, this all is the medial surface of shaft of tibia, and it form a V-shaped relationship with the three muscles. Okay, this line of V is for sartorius, this is for semitendinosus, and in between this V there inserts a gracilis, and these three tendons form a pes and serenius. Okay, sartorius small, semitendinosus and gracilis. Now coming towards the innervation, this all part is supplied by the obturator nerve having a root value L2, 3 and 4. Okay, except the hamstring part of the adductor magnus, which is supplied by the tibial part.